Welcome back to AM Northwest. You know, February is American Heart Month. Here to explain the connection between chronic pain and heart disease, we welcome back the president of the Association for the Treatment of Neuroplastic Symptoms, Dr. David Clarke. Great to see you again, doctor.
Great to be back.
Let's talk about this. Your specialty is fascinating. You say 1 in 5 adults suffers from chronic pain or illness that is either medically unexplained or doesn't respond to the usual treatments. Tell me about that.
Yeah, that's right. I mean, most people assume if you've got pain or illness, you must have a disease or injury to explain it. And
Right.
that's, absolutely how I was trained as a physician. But it turns out there's a whole other category where the brain can cause pain or illness in your body that's 100% real, that can be just as severe and just as long-lasting as any other form of illness. But the good news is we've got breakthrough research now that this can be successfully diagnosed and treated.
How? Give me an example of someone that you've treated in this way.
Well, one of my favorite stories is a patient who, when I first came to see her, she'd been overnight in the hospital for extreme dizziness and vomiting. And she said, doctor, don't waste your time with me. And I asked her why, and she said, I've already been hospitalized 60 times at a prestigious university for exactly the same thing, and they can't find anything wrong with me. And I said, well, I couldn't resist a challenge like that.
Yeah.
So I said, why don't you give me half an hour and just tell me your story one more time. And
Right.
It turned out all of her attacks of illness were connected to direct or indirect interactions with her abusive mother. And
Oh,
her mother
wow.
had been mistreating her since she was 3 or 4 years old.
Wow.
She's now 50. And I could directly make connections between her attacks of illness and when she was having problems with her mom. And it's just bringing that into conscious awareness, in her case, was enough to alleviate the symptoms. She never had another attack.
So you're saying trauma can give you cardiovascular disease?
It can give you symptoms from head to toe.
Head to toe.
Migraines, fibromyalgia, irritable bowel, pelvic pain, low back pain is a big one. Chronic fatigue, long COVID, certain kinds of rashes, chest pain, difficulty breathing, visual disturbances, the list just goes on and on. But the good news is we've got new research now that shows this can be successfully treated.
How? How do you treat that? Because back in the day, they would say it's all in your head.
Yeah, I hate
Right?
that phrase, and it should be banned because
Yeah.
these are real symptoms. What's going on is there are neuroanatomic changes in the brain. The circuits are actually different. So there's a real physical reason for this. But if we can identify the stress that's behind it, and in a lot of cases it was treatment of the person as a child in a way that they would never want for a child of their own. And that can carry on in a variety of ways into the adult years. My very first patient became ill at age 35, and she had been abused as a girl up until age 12. There's a 25-year gap before her symptoms started, but we could still alleviate her condition successfully.
And how did you do that?
Well, we help people recognize the magnitude of the stress that they were under. When people look back and they think about their own child growing up exactly the way they did, then they can get a more realistic sense of how much they had to endure and how proud they should be of themselves for having overcome it. And that can help bring the stress level down. There's other techniques as well, but the overall idea is to find the stresses, bring their level down, enable people to take better care of themselves, take more time for their own joy, and they start to see progress. The symptoms begin to move.
Do you think then if people are suffering maybe with heart disease, a look at therapy would be kind of important?
Well, there is a link. People with chronic pain do have a much higher rate of heart disease, cardiovascular disease, stroke, which is interfering with the circulation
Right.
to the brain. So there is a link there. But my own impression is that the link can go all the way back to people who were mistreated as children and the stress level there. There's good statistics that show that adversity in childhood can play out into physical problems as well as neuroplastic symptoms, we call them. If people are curious about this,
Yeah.
the website symptomatic.me has a 12-question quiz where people can assess their own symptoms for how likely they are to have a neuroplastic origin.
Neuroplastic origin. Go define that for me.
Yeah, neuroplastic. Neuro just means brain and
Okay.
nerve circuits, and the plastic is actually quite a hopeful piece because what that means in medical jargon is a capacity for change.
Oh, okay. Let me ask you this too, because we talked about this quite a bit when someone, long time marriage, 50 years, say, and one of the spouses die and the other dies shortly after. And we say that's basically real life heartache. That's an example of it, right?
Yeah, that's a huge stress on a person. Losing a spouse is one of the biggest stresses that you can go through. And it's no surprise that it's going to activate the body's fight or flight system. That can raise the blood pressure, cause problems with the immune system. So yeah, a lot of physical impacts from stress. But this can go back to a very simple example that almost everybody's experienced. If you're in a tense situation and you feel a knot in your abdomen, that's a physical response to stress. That's a brain to body phenomenon. And this form of illness, the neuroplastic symptoms, is just an exaggerated, longer lasting form of that, but 100% real.
Wow, that's fascinating. We're going to put all the information on and a link to your quiz too on our website at k2.com. Doctor, thank you so much.
Thank you.
All right, we'll be right back with more AM Northwest. Don't go away.